Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Salivary gland tumors. So first is we look at the risk factors. The risk factor is that there can be radiotherapy. So there is radiotherapy and this is nothing but of the head. So radiotherapy of the head, then also there is involvement of the neck, and this increases the mucoepidermoid carcinoma. So increases the mucoepidermoid carcinoma. Next is the Epstein-Barr infection, the EB infection, and this is a risk factor for the lymphoepithelial carcinoma. Lymphoepithelial carcinoma. Next is the exposure to the silica. So there is exposure to that of the silica. To the silica dust and also the nitrosamines. So they may increase the risk. Next is early menarche and nulliparity are associated with the higher risk. Early menarche as well as the nulliparity. Then comes the trisomy of 5. The trisomy 5 is a high risk for the mucoepidermoid carcinoma. And when you look at the translocation of the chromosome 11, it also may be involved. So translocation of the chromosome 11 and the polysomy of the chromosome 3 as well as 17. They are risk of the adenoid cystic carcinoma, so 3 and 17. So how to diagnose the salivary gland tumors? It is by the FNAC, fine needle aspiration cytology. Is a investigation of choice for the diagnosis. Then we can also have the MRI is the best imaging investigation for the salivary gland tumors, and open incision biopsy is contraindicated. Open incisional biopsy is contraindicated due to the risk of the tumor cells seeding in the tract and increased risk of the parotid fistula. Parotid fistula. Then looking at the risk of malignancy is inversely proportional to the size of the gland. So malignancy is inversely proportional to the size of the gland. Now let's look at the managing the salivary gland tumors. So management, if you see, it is by the surgery. So surgery is the principal treatment, and the surgical exception alone or in the combination of the radiotherapy. For parotid tumors, depending on the involvement, options include the superficial parotidectomy, and also superficial parotidectomy, the deep lobe parotidectomy, the total parotidectomy, or the radical parotidectomy. For the other salivary gland tumors, the en bloc excision of the tumor and the gland is done. So en bloc can be done. Next is the neck dissection. The neck dissection is performed in cases of, so there is neck dissection. So neck dissection is performed in cases of the clinically palpable nodes or high malignancies, or in terms of high malignancies. So radiotherapy is indicated in high tumors. So radiotherapy is indicated in case of high grade tumor, and there is a large primary tumor, the perineural invasion, as well as the bony invasion, and the positive margins, and also the cervical lymph node metastasis. Next is the chemotherapy has a limited role in the salivary gland and the thyroid tumors. So the chemotherapy, it has a limited role. The limited role in the salivary gland and also the thyroid tumors. So this is due to the incomplete and the short-lived responses, and there is no survival. So there is no survival advantages. To learn and grow daily like this, please do subscribe. you.